But to go ahead and get things started, I would love to go ahead and introduce Dr. Antonio Dos Arreyes Vega, who's going to be talking a little bit more, as I mentioned, about the medical side and understanding of cancer. So the floor is all yours.
Thank you for inviting me. I have chosen a title which is one of every age, because that's the message you have to take home. My everyday job is to be a doctor. I'm a gynecologist. I live and work in this hospital in Madrid, and this is my team. We deal with fertility matters, and within that fertility matters we are related with breast cancer, for example, doing egg prevention, egg freezing of people that suffers cancer. But this is my job, but my passion is other. My passion is life, my family, my big family, my friends, and communication. This is my way of being happy, being glad, is communicate, is to emotionally communicate with people. This is the subject of today, breast cancer, one of every 8. I divided the speech in 3 steps: human breast cancer, and the key point diagnosis. How many human breasts would we have? It seems a simple question, right? We will always answer 2, but it's not always true. Other animals have 8 breasts. Most of us have 2 breasts, but from time to time, some of us, 10% of us, have a third or even a fourth small breast. In that line, in the line in between your breast and your genital line. Which is a function of your breast? Is only nursing? It's supposed to be only nursing, but it's not like that in nowadays. It's more every day like a way of communicating with others, let's say. So the shape and volume is hardly different, but it's a subject related with your hate and love. This is a hate and love relation in between a girl and her breast. Some cultures have even hate breasts, and they try not to have breasts even. Which is the structure of your breast? Of course, it's covered by skin. Your nipple is the center of a big numbered quantity of conducts. At the end of every conduct, you'll see a gland that makes milk, or that can make milk in the future. So this structure is dynamic. When you are getting fat, most of this yellow thing, which is fat, will grow, so your breast is going to be bigger. And when you are lactating, your tissue will be big. What's structure is dynamic? The skin is dynamic. With the passage of the time, the skin will come down. Your muscles, which are on the back of the breast, will come down if you don't do exercise. And in the back part of all, you'll find your ribs. And sometimes, if you press in the place of your breast, which is closer to your ribs, you will feel some pain there. Okay. Look, the upper part of the slide. There you will find the non-lactating breast. When the breast is lactating, it will grow and will full of milk. This structure is interesting. You see here a layer of cells. It's about the same as this layer. Okay, this layer is the nest of a breast cancer. That's the problem. That ducts, that line of ducts. Breast cancer has been around from always. Look, the old painting. They were cutting the breast. how did we get to the normal, to the nowadays treatment? This famous actress had all two breasts put out because she has some specific cancer. Look here, this prehistoric medicine. They were cutting the breast, and with some fire, they were setting fire here to avoid bleeding and to avoid infection. Soon afterwards, they still did the same. Look, this 17th century, all the fire here and all the terrible treatment they had. They had no cure. Look here. They had this sort of knife to cut the breast and to set fire afterwards. So in the 19th century, in the around 118th and 19th century, they started in the States doing new things. This is a surgery. It sounds more like a library, or you see up here people having a go. They don't have masks. They don't have almost everything, and they are doing surgery. This man, Halsted, is the most important man in the whole history for this matter of subject of breast cancer. This man was the first who invented a method for curing people. You see here, he is doing surgery without masks, without almost gloves. They knew that after doing breast cancer surgery, most patients died from infection. The smell was similar to all the dirt. So they invented giving disinfectants. Here you can see a spray of disinfectants over the surgery area, over and during the surgery area. So they need to use gloves, not soft gloves as today, really heavy gloves. Could you imagine doing surgery with gloves? It's really difficult to do that with that thing. So in the funny story of humankind, this girl, Caroline Hampton Halsted, that girl was the origin of surgical gloves. Look how interesting is this. This lady, Caroline Hampton, was the nurse in charge of the operating room of this famous man of Halsted. As she was an unusually efficient woman, he got a consideration of her. She requested to protect her better from the solutions of chloride that had dermatitis in all of her. Then they asked Goodyear to do rubber gloves. That's why we think this nurse is the inventor of what we do use every day in the surgery area. Finally, they got married. So we think that gloves was a story of love. These kind of things about medical story you can learn about the book, but I would advise you that you are not doctors and most of you are not going to be doctors, to read this book about the serendipity, about the chance of inventing things just by chance, because it has been really quite frequent in the story. Why Halsted has been so important in our lives? Because he was stubborn and she wanted to find a room for curing people. Then he invented a really heavy surgery, really heavy surgery. And in 1882, he did the first mastectomy, radical mastectomy, putting out the breast and the muscle. And he was the first one to cure one girl. This is the surgery, putting out almost everything. Then the merit was not to put everything out. The merit was to get a way of non-infecting afterwards. So after that drama, things has been changing a bit. Nowadays, what's the point of view? We want and we need to put out the whole breast, but keeping the muscle. That name is modified radical mastectomy, and this is the horror we do every day. To avoid that horror, we invented some things. It's flaps. First flap is to take one part of the body, muscles included, make a tube under the skin, and set that flap instead of the breast. So it gets a bit better, I would say less worse. But they have some volume, they're more glad. Someone invented another kind of flap, is getting a muscle from your back, setting out the muscle, changing and turning it, to giving some volume to that flap, but still we don't have something good for ladies. What about if we, instead of setting the full breast out, we set just the tumor? If we set just the tumor, the patient won't cure unless we give radiotherapy. So in the 70s in Italy, someone invented that if we give radiotherapy to patients, we could take out only the tumor. That enormous invention makes a lot of effort and a lot of merit to these mates, the radiotherapy specialist doctors. They save people, giving them radiation. They have to make a lot of numbers to give the exact radiation to the tumor without affecting the whole body. It's not perfect, but it's saving lives, and it's saving breasts, and it's making more happy people. So if treatment is a disaster, if we cannot treat without keeping something nice and glad, essential is to do diagnosis, to do early diagnosis. The sooner we do it, the better. What is not a cancer? People that don't understand well, they're no doctors, what always they have something in the breast, they think it's a cancer, and it's not. There's a lot of things in the breast that cannot be a cancer. Infections, cysts, and that. And this is the most important part in your young age. Most of the times you find some problems in your breast with, let's say, 20 years old, it will be a cyst or be an infection. You are not going to have a cancer with 20 years. Pain is not well related with cancer. Pain is an alarm sign. You will alarm. It's not going to be a cancer, but you have to come and we have to explain you that most of the time you have some pain in your breast is from musculoskeletal origin. And if your breast is painful cyclically, if you have your breast pain every month, this is due to hormonal imbalances and can even radiate to the underarm area. Then if it's cyclic, you have bad luck, but you don't have to worry a lot. If it's not cyclic, then you have to worry a bit more. Sometimes it's a breast cancer, but most of the times it is not. It will be an infection or other thing, but not a cancer. So if pain is not the best sign, which are the signs, the signals of breast cancer? Change in the size of the shape of a breast, signs of change in the skin, an abnormal lump, change in the nipple, discharge in the nipple, or funny pain sometimes, but most of the times is an organical change in your breast. Which is the most important thing? I said that in red, in big letters. I cannot be more intense. The most important thing is self-exam. You are your doctor for your breast. Then you have to check your breast. It doesn't matter if you do in circles, in lines, in whatever. The important thing is you have to be checking your breast, let's say once a month or once a week, because you need to be used to touch the small parts of their own breast. This is brilliant. I advise my patients to check their breasts under the shower, because they have soap and water and it makes easier to touch. So I saw this and it's a good idea to set that cards on hotels, on places, on bathrooms, on the places that people, James, where people have their shower, to remember that is the good moment to check the breast. If you find in your breast anything funny, anything strange, second step in your age should be an ultrasound. An ultrasound is like a microphone. We set that microphone over your breast, and the sound gives us some figures, some different images. Some of them are rounded, probably benign. Some of them are more speculated, and the more the speculation, the more risk you have with your cancer. This ultrasound gives us most of the times a precise diagnosis. If it's a cyst, it's full of black, it's water, or if it's full of flesh of a cancer, most of the times ultrasound is enough. But for other ages, and specifically for healthy breasts, the best diagnosis is under mammography. What is a mammography? Mammography is an X-ray over your breast. If your breast is big, it's easier to do the mammography. If your breast is not big, it's more difficult to do the mammography and it's more painful. And these are the kind of images we find. Do you see here the star? Do you see here another star? Do you see here another one? It's like a small star retracting tissue from around. Not always is easy. Sometimes your breast is made fully of fat. We call it fatty breast tissue, which is low density and easy to see around. The more the density you have, the most difficult the diagnosis is. So for certain kind of breasts, mammography is not enough. So someone invented this, which is really ingenious, which is magnetic resonance. You have to see that the girl is downwards. The breast is hanging from her chest, is hanging, so the image is full. You see here how you can see the full breast. With mammography, you will see only this part, this upper part. With resonance, you will see fully the breast. And the most important part of magnetic resonance is that you can see more than images. You can see metabolism. You can see if the tumor is eating a lot of energy, so images are even brighter, even easier to see. So magnetic resonance is a gold standard for certain kind of breasts and certain kind of tumors. You see here this really small tumor. This tumor possibly wouldn't have been diagnosed through the mammography because it only cuts that part. Once you have the suspicious data, echography, ultrasound, mammography, resonance, those are suspicious diagnoses. We need to know exactly that that's a breast cancer and the kind of breast cancer that is. Sometimes you can do it just with a needle, with a needle biopsy. We see that through ultrasound and we take just a small sample with a puncture. Other times we need to use a specific needle which makes a vacuum. You put the needle we do some vacuum, then it cut again, taking some part of the tumor. Sometimes we need that vacuum system. Other times you have to do a surgery to take that piece out and check it. So after the diagnosis, we can start treatment. Which are the risk factors that affects this? Look, the first risk factor is obvious. Is to be the gender, to be woman. Second is the age. The more the age, the easier the cancer. Third is the family story of breast cancer. You have to think in the women or your maternal size. Women of your maternal size. If you have 2 aunties and 3 cousins and 1 mother, you have the number. I have 1 cancer out of 10 people, my risk is medium. If you have 3 cancers out of 10 people, the risk is high. Of course, if you have a personal story of past breast cancer, you will have more easier second cancer. And some books says that breast tissue density is a risk factor. It is not. It is not a risk of having more cancer. But as the breast is more difficult to have a look, we take longer to diagnose them. So we cannot diagnose small cancers. So the cancer will affect you, will be bigger. Sometimes people say things like these: tips to reduce the risk of breast cancer. Really, there is only one: is having a full nursing soon, is having a baby. If you have a baby soon, your breast gets mature and the risk of breast cancer is lower. All these things, alcohol, smoking, exercise, diet, will have a really small impact having breast cancer. It will have an impact on mortality, because we will diagnose cancer easily instead of wait until it's late, but they don't reduce the risk of having a breast cancer. So the essential part is the prevention. We know the risk factors, and the prevention is the screening, is to check soon the tests, and in the future we will have a chemical prevention and biological prevention. And in the very long future, someone will invent nanoparticles, which is a small particle that goes directly to the cancer, affecting the chemotherapy specifically on the cancer. It's going to be, I don't know, 5 years, but it will be in the future. We will invent some medication to go directly to the breast. I'll start the end of my talk. Which are the take-home facts you have to write down? Early diagnosis means a better chance of successful treatment. Self-examination is an essential part of early detection. Mammography is the best tool. Recommendations differ. Most of countries, most of races, here the problem is that not every race has got the same risk. Black people has got low risk. Caucasian people, they have a bigger risk. If you are blonde, blue eyes, Caucasic and that, your risk is higher than if you are dark, or if you are brown eyes, or if you are from other regions. And magnetic resonance may be used in really risky women. Why early detection? Why we have to do an effort to detect this? First, because we will get soon. If we go soon, we will give you a nicer treatment. Instead of removing the full breast, we could perhaps put out only the tumor. So early detection will give you more quality in your treatments. But the second reason is the mortality is lower if the affection is only local, than if there is an extension or an nodal involvement of even if it's a metastasis. So it's essential to keep all the cancers local. It's essential to come soon. And to come soon, there is only one way, that you have to keep an eye over your own breasts. Keeping an eye over all the symptoms we've been talking. Keeping an eye of doing self-examination every week or every time you have a shower. And remember that you are a good tool to do breast cancer awareness in other people. This figure is so essential that I've chosen that for my title. 1 out of 8. Take your contacts in your mobile phone. Count how many of them are there. 1 out of 8 will have a cancer. And still, nowadays, 1 out of 37 girls you know will die from breast cancer. 40 is the important number. 40 is the age to start doing mammographies. 40 is the risk of dying breast you can save. And most lives are saved when we start doing mammographies at 40. Remember, 75 people, they don't have family. People feel safe and they are not safe. Early detection is essential to reduce mortality. So, humankind said that early detection saves lives and the breast cancer awareness is essential. So the key point is come early. That's why October is this month. Why? We're doing this with you if you're 20 years old. My God, it's not your business. It's not your business. It will be your business within 20 years. Yeah, but if you think carefully, it is your business. Because you have a mother, a sister, in the future, a daughter. You have to keep the message out there. It's essential to do mammographies after 40 and check your breast in every shower.
Yes, my question would be is in the importance of if you're from an ethnic background and also the importance of having access for less advantaged people in a lower social ability background. And that's to the doctor, can't say your last name, but if that's my question to you as an expert, Dr. Is it Antonio?
We have a lot of difficulties to give and to go to everywhere in the world to give health technology. If a country has got no technology, at the end all the health is suffering for infections, for the health of the water, for everything. Then the expectations of life is short. This illness, breast cancer, is bigger in old people and also is bigger in Caucasian people. So in other countries, this is a small problem. It has been about the same with COVID. In other countries, it has been not a big problem because there are young people and strong, not here. There are a lot of old people. But technology is the key. Without technology, without money, without technology, we cannot get to everyone. But I think in that part of the world, I would spend much more money in other things that people are not so they don't think are not so important, but it's key. For example, cleaning water and vaccines. For example, vaccines is the best tool for safe health for the people. Then breast cancer is important for today's talk, but sometimes it's not important, just other simple things.
Thank you.
Yeah, Alina and maybe Dr. Antonio, I was wondering, what are the best ways to be there for someone who has a family member or someone close to them that's going through cancer? So, like, how would you be there for a friend who has a family member that's suffering or diagnosed?
Alina, you do first, and I do afterwards. You want?
Okay. I think that question kind of, me personally, I think it kind of depends on. I think personality. I think depends on that a lot. But personally, I think it's just about support. Whether that's like checking in on your friend and making sure that they're okay, or I think the best thing is also not really pushing them. Like if they feel that they don't want to talk about it, then maybe don't push them to talk about it, but make sure that you're always there as a figure of support in their life, that you make it very clear that if they ever needed anything, that they could reach out to you, that you just make yourself available to them as a figure of support, as a listening ear, shoulder to cry on, everything, that you just make it clear, but also don't push them. If they don't want to talk about it, if they just need you there from a distance, then you just need to do whatever in specifics that they need. So.
Okay, it's my turn. Look, I said a sentence in the first slide, which is emotional communication, which is my way of thinking in medicine and in this matter also. Imagine you have some big problem. You are sad because, I don't know, let's do something. Your boyfriend let you down. And you find someone in the same situation. Another, let's say, girl like you with the same problem. And you share problems. Did you get better? No. Sharing problems is not getting better. When you have a problem, you don't want people to come down to you to share the problem. You want to come out from the problem. So the way of supporting someone who's got a problem, whatever the problem is to take her or him out of the problem. So imagine I had something like, I don't know, I have a miscarriage. I've been for a week out from my work, and I go to my work and every single one says to me, oh, I'm sorry, oh, I'm sorry, oh, I'm sorry, oh, I'm sorry, 50 times a day. Then what's the best idea? If you are the patient with a problem, just face it soon and altogether. Hello everyone, as you know, I came again from my miscarriage process. I'm destroyed, I don't want to speak a lot about that, but please, let's stop talking about this now. Let's keep the life follows. So if you want someone with a problem like that, support means develop the way to happiness, means give him, her, what he needs to be happy, and it's not talking about cancer again. Don't feel afraid of not being there. You are not a doctor, you cannot do anything, but you are a friend, you are a relative, you go drinking, you go disco, you whatever. What they need is that you take them out of the problem. So even if they don't want to go out, you go there, take her from the neck and come out to the sun, right? So giving support is to keep life flowing. Thank you.